Top 5 Awful Facts About Medieval Medicine. 1. Poisonous anesthesia. One of the most common misconceptions about medieval medicine is that doctors performed operations on patients live, without any anesthesia. No, anesthetics were already available then. Another thing is that their quality, of course, is not at all comparable to modern ones. The substance used as an anesthetic was an unpleasant infusion of herbs mixed with wine. Most often it was belladonna, hemlock and opium, taken in different proportions. Such a remedy only slightly reduced the patient's sensitivity, but that was the least of the problems. A great many patients died not from wounds or pain, but from poisoning by an improperly prepared anesthetic decoction. 2. Military field surgery. In the Middle Ages it was deadly to catch even a common cold, let alone any serious wound on the battlefield. And the biggest problem was arrows. Arrowheads in those days were not always glued to the shaft, more often they were attached with warm beeswax. When the wax hardened, the arrows could be used without problems, but after the shot, when it was necessary to pull the arrow out, the shaft of the arrow was pulled out and the tip often remained inside the body. Especially for such cases, an arrow removal spoon was developed designed to clamp the tip of the arrow and pull it out of the body. The wound was then cauterized with red-hot iron to stop the bleeding and prevent infections. 3. Trepanation. Trepanation is the drilling of a small hole in the skull in order to access the underlying cavity and intracranial masses, for their subsequent removal. In the Middle Ages it was believed that this practice, which relieved intracranial pressure, could cure health problems localized in the head, although it was also believed that trepanation could cure epilepsy, migraine, and mental disorders, and was supposed to fix such physical problems as skull fractures. Needless to say, such a dangerous exit to the brain could often be fatal. Besides, one can only guess how much it was painful. 4. Red-hot iron against hemorrhoids. It was once believed that if one did not pray to Saint Fiacre, protector against hemorrhoids, then, as you may have guessed, he would suffer from it. If you happen to be one of those unfortunates, you will be sent to the monks who will shove a red-hot iron up your anus. Not a very pleasant, to say the least, procedure. But a less painful alternative was not as effective. The monks would send you to sit on the famous St. Fiacre stone, the site where, in the 7th century, an Irish monk was miraculously cured of hemorrhoids. It was for this reason that throughout the Middle Ages hemorrhoids were called Saint Fiacre's disease. By the 12th century, much had changed. The Jewish physician Moses Maimonides wrote a treatise of 7 chapters on the treatment of hemorrhoids, questioning the remedies of the era. He suggested a simpler method: sitting baths. 5. Boar's bile enemas. Enemas in medieval times were made in the form of devices called clysters. It was a long metal tube with a mug on the end. It, like an enema, was inserted into the anus and medicinal liquids were poured into the mug. The liquid was then injected into the colon with a series of pumping actions of a piston. Unlike the warm soapy water used for enemas today, things used to be a little more down to earth. One of the most common enema fluids was wild boar urine. This treatment became fashionable in France and was even used by monarchs. King Louis XIV of France is known to have had about 2,000 enemas during his reign, some even administered while he was sitting on his throne.